Greetings from Revive Chiropractic Centers in beautiful Lexington, Kentucky. My name is Teresa Brown, and I am the Functional Mobility Specialist and Director of the 8 Weeks to Wellness program here at Revive. Today, I would like to share with you why we incorporate cardiovascular, mobility, and strength training together in the physical activity component of the 8 Weeks to Wellness program. But first, let's take a look at each of these components individually to learn what they do for the body. Cardiovascular training is the type of training that focuses on our circulatory system. This system includes our heart, lung, and blood vessels. Sometimes we call this type of training aerobic or endurance training, which simply means that we are using an energy system that requires oxygen. When we train our cardiovascular system, we strengthen our heart and blood vessels, and we also increase our lung capacity and endurance. This type of training is good for lowering the risk of heart disease, lowering blood pressure and cholesterol, as well as supporting weight loss and better sleep quality. A brisk walk, jog, or biking are examples of this type of training. Mobility training is a type of training that focuses on increasing movement around a specific joint and creating proper movement patterns, as well as mitigating muscle stiffness and soreness. The goal is to prevent injury, treat and resolve pain, and improve joint and tissue restrictions. Because of the lack of visual appeal, we tend to overlook the importance of this type of training. But by incorporating mobility in your training regimen, you can enhance your performance with your ability to move better. By working to improve joint and tissue restrictions, you will be able to develop proper movement patterns, which will allow your training to be built on a firm foundation. For example, the banded hip extension mobilization technique is used to open up the front of the hip. This technique improves hip and low back pain. Strength training is a type of training that focuses on getting us stronger by overloading our muscles progressively. We strength train not only because it makes us look and feel good, but it can also reduce body fat, increase lean muscle mass, burn calories more efficiently, increase bone density, and build confidence, among other things. Examples of strength training exercises include squats, deadlifts, bench presses, and military presses. So as you can see, cardiovascular training, mobility training, and strength training are equally as important to a physical activity regimen. That's why we include all three components in each 8 Weeks to Wellness workout. As a result of this type of programming, our participants are seeing amazing results that include lowering their blood pressure, lowering their cholesterol, lowering their body fat, increasing their lean muscle mass, and they are also losing weight and getting off of medication. As an added bonus, our participants look and feel great with more energy. So if you're looking for a program designed to improve your most valuable asset, your health, then look for an 8 Weeks to Wellness program in your area. This is Teresa Brown from Revive Chiropractic Centers. We are wellness warriors because wellness works.